Dr. Sophie Albert, cardiovascular and wellness specialist, age 35 plus, health longevity doctor archetype. You've probably already seen the headlines by now. Mysterious virus case detected on cruise ship. And if you're anything like many of the people who follow this channel, your first reaction over the past couple of days was likely one of two extremes, either immediate fear or immediate dismissal. Not this again. Another media panic story. Another virus people are overreacting to, but I need to tell you something carefully right at the beginning. Both reactions, panic and total dismissal, can leave you less prepared than you were before you clicked on this video, because by the time we finish today's discussion, you're going to understand something most headlines are failing to explain properly. You'll understand exactly how this virus affects the human body. You'll understand how transmission actually happens. You'll understand what those mortality statistics really mean when they're placed into proper medical context. And most importantly, you'll understand what your real personal risk looks like right now. Not fear, not false comfort, just science, context, and practical awareness. And there's one concept I need you to stay with me long enough to fully understand. In infectious disease medicine, there's a very specific reason specialists consider this virus uniquely dangerous compared to many others people hear about online. I call it the silent exposure problem. And once I explain what that means, which I will in just a few minutes, the entire cruise ship situation people are talking about will suddenly make much more sense, because that missing piece is exactly what most social media discussions and news coverage are ignoring. So let's build the foundation first. Most people right now are operating with almost no accurate information about this virus. First important fact, this is not a brand new virus. What we're discussing is part of a viral family that has existed for decades. Researchers have been studying strains within this family since the 1970s. The name originally came from a river region in South Korea, where one of the early strains was identified. So unlike completely novel outbreaks, scientists already understand a significant amount about how this pathogen behaves. And that distinction matters far more than most people realize. Because whenever you hear about an outbreak in the future, the first question should never be, how deadly is it? The first question should always be, is this a known pathogen or a completely new one? That changes everything. A known pathogen has documented behavior patterns, established transmission pathways, historical medical data, predictable exposure situations. A novel pathogen creates uncertainty. COVID-19 was dangerous partly because in the early stages, the scientific community was still trying to understand how it spread. This situation is fundamentally different. Now let's clear up the biggest misunderstanding I'm seeing online right now. Many people are assuming this virus spreads easily from person to person through casual contact, shared air, or simply being near someone infected. For the overwhelming majority of known strains, that is not how transmission occurs. The primary carriers are rodents, different species depending on the region. In North America, deer mice are one of the major concerns. Other regions involve different rodent populations. The virus exists inside their urine, saliva, and droppings. Now here's where the danger becomes important. Over time, those contaminated materials dry out.
And once dry, tiny microscopic particles can become airborne inside enclosed spaces. That means the actual exposure often happens when a person unknowingly breathes contaminated particles into their lungs. Think carefully about the environments where that becomes possible. An old storage room, a garage closed for months, a hunting cabin, a basement, an attic, a barn. Any enclosed space where rodents may have been active without your knowledge. You enter the area, you begin sweeping, moving boxes, opening old containers, disturbing dust, and suddenly particles too small to see are floating through the air around you. No smell, no warning, no immediate symptom. You walk away feeling completely normal. That is the silent exposure problem. The moment of exposure feels like absolutely nothing, which means awareness matters far more than panic, because this virus doesn't usually announce itself dramatically at the beginning, and that's exactly why proper prevention matters. If you ever clean an enclosed space with possible rodent activity, the process should never be rushed. Open doors and windows first. Allow ventilation for at least 30 minutes. Wear an N95 level mask if possible. Use disinfectant or diluted bleach solution before wiping anything. Never dry sweep contaminated dust. Never aggressively vacuum without proper filtration.
Those simple steps dramatically reduce risk, and most people never think about any of this until after exposure may have already happened. Now let's talk honestly about what happens if the virus enters the body, because this is where context becomes critical. There are two primary disease patterns associated with this viral family. One mainly affects the lungs, the other primarily targets the kidneys. The lung-related version often begins deceptively mild. Fatigue, muscle aches, fever, headache. Most people initially assume they have a normal viral illness, but several days later, symptoms can escalate rapidly. Fluid may begin accumulating inside the lungs. Breathing becomes difficult, and in severe cases, emergency intervention becomes necessary very quickly. The second form is more associated with kidney involvement, severe inflammation, internal bleeding complications, acute kidney dysfunction, sometimes requiring dialysis support. Now I want to pause here carefully. I am not sharing these details to frighten you. I'm sharing them because accurate information is what allows rational decision making. But here's the part most people fail to understand correctly. Mortality rate and population risk are not the same thing. A disease can have a high fatality percentage while still posing relatively low overall public risk if actual exposure situations remain uncommon. And that distinction matters enormously. Current international health assessments continue to categorize overall population risk as low. Why? Because this virus does not spread efficiently through normal, everyday human interaction. It is not circulating casually through grocery stores, offices, restaurants, or crowded sidewalks the way respiratory pandemic viruses do. Exposure usually requires a very specific environmental situation. That narrow exposure window changes the entire public health equation, and that's why experts are not treating this like another early 2020 scenario. Now, before we continue, I want to speak directly to viewers over 45 for a moment, especially men. Your baseline metabolic and immune health matters far more than most people realize. Sleep deprivation weakens immune surveillance. Vitamin D deficiency affects immune response quality. Chronic stress alters inflammatory balance inside the body. excess visceral fat creates long-term inflammatory strain that reduces resilience against illness. This is not cosmetic, it's physiological. And if you already live with conditions like hypertension, kidney disease, cardiovascular disease, or diabetes, your health baseline changes how your body responds to serious infections. That's why prevention matters long before exposure ever happens. Let me ask you something honestly. When you first saw headlines about this outbreak, what was your first emotional reaction? Fear, dismissal, curiosity, confusion? Leave it in the comments, because honestly, how people emotionally process health information tells me a lot about overall health literacy. Now, here's the uncomfortable truth some viewers may not want to hear. The people at highest individual risk are often not the people panicking online. The truly higher risk individuals are frequently the ones who completely ignore the information because the overall population risk sounds low. But individual risk depends entirely on personal exposure context. If you work in agriculture, construction, wildlife management, forestry, pest control, environmental cleanup, or older buildings with rodent exposure, your situation is not identical to someone working in a downtown office tower. If you own an old cabin, storage area, basement, garage, or barn with possible rodent activity, this information directly applies to you. So here's the practical 3-step protocol. Step 1, assess your environment honestly. If rodent signs exist, take them seriously. Step 2, if cleaning is necessary, ventilate first, disinfect surfaces properly, avoid dry sweeping, and wear appropriate respiratory protection. Step 3, know the symptom timeline. If fever, severe muscle aches, or breathing difficulty appear within weeks after potential exposure, seek medical care immediately and specifically mention possible rodent-contaminated exposure. That information changes how physicians evaluate the situation. And now we return to the second half of the silent exposure problem, the incubation window. Symptoms may not appear immediately. In some cases, the period between exposure and illness can stretch across several weeks. During that entire time, the individual may feel completely normal, working, exercising, traveling, living everyday life. No warning signs, no obvious indicators, and then symptoms suddenly begin. This is why awareness matters more than fear. Fear does not improve outcomes. Practical awareness does. Knowing the environments that create risk, knowing prevention protocols, knowing symptom patterns, knowing when to seek help quickly. That is what actually changes outcomes. So let me close this clearly. At this moment, there is no reason for widespread panic. There is no reason to isolate yourself from normal life. There is no reason to assume every public environment is dangerous. But there is absolutely a reason to become more informed about high-risk exposure situations that many people ignore. Understand the cleaning protocols, understand the symptom progression, understand the incubation window. And if you fall into a higher exposure category, take that seriously now, not weeks later after the headlines disappear. One final question before you leave. Do you currently have an enclosed space somewhere in your life? A garage, basement, storage room, cabin, or attic that you haven't fully checked for rodent activity recently? And after today's conversation, are you more likely to inspect it properly? Let me know in the comments. If this video gave you clarity instead of just panic, share it with someone who needs actual context right now. And subscribe to the channel because next week I'm breaking down something directly connected to today's discussion, how the immune system changes after age 45 and what you can realistically do to strengthen resilience against serious illness naturally. Until then, stay informed, stay calm, take your health seriously, and never allow fear to make your decisions for you.